So we're going to begin. Good morning, everybody. Welcome. I hope you all had a great long weekend. Maybe you're out playing around with golf. I certainly was, enjoying the weather, and I hope you were able to rest and recharge. Welcome to our conversation this morning regarding Ontario's vaccine rollout and what that means for your business. We've of course brought to you a panel of experts to share more about what is happening locally in Durham region, what it all means for you and for your employees, for your business, and to share with you what's happening across the province and how businesses across the province are contributing to the ultimate goal of ending the pandemic. My name is Nicole Gibson, the Executive Director of the Ajax-Pickering Board of Trade. And once again, thank you for your time and for joining us here this morning on a beautiful Tuesday. So while of course there is light at the end of this tunnel, we do know that our fight with COVID-19 is not yet over, and public health and the health of our economy are interdependent, and so we will continue to promote the importance of vaccinations in our community so that our businesses and our local economies can reopen safely. Joining us this morning, we have a fantastic panel of experts. We have Dr. Pepi McTavish, Associate Medical Officer of Health for the region of Durham, Christine Ashton, partner lawyer at Wilson Vukelich LLP, and shortly Rocco Rossi, the president and CEO of the Ontario Chamber of Commerce, will be joining us as well. Thank you to the three of you for your time this morning and for this important conversation. Of course, the Ajax-Pickering Board of Trade is proud of its partnerships with the regional municipality of Durham, with the town of Ajax, the city of Pickering, and the Ontario Chamber of Commerce. And at each level of government, the boards of trade and chambers of commerces across the province, along with the support of our business communities, are working together like never before to support the reopening of our economy and to offer guidance to our political representatives whenever possible. Our speakers today are going to provide you with the information you require to provide a safe workplace currently, as well as upon reopening as we move through our new framework, the knowledge to implement specific policies and procedures within your business and for your employees, and we'll shed some light on the insights on the Ontario Vaccination Support Council, as well as all of the resources that are available for you. At this time, I'm going to introduce our first speaker from the region of Durham. Please help me welcome to the virtual stage, Dr. Pepi McTavish, Associate Medical Officer of Health for Durham Region. Good morning, Dr. McTavish.
Morning, bear with me while I share my screen on Zoom.
Absolutely.
Ignore the messy desktop. Okay. Is that? Okay. Is that sharing okay for everybody?
Looks good to me.
Okay, perfect. So I'm just going to take you on a very brief overview of what's going on with vaccination right now. I know there's a lot going on in the background about reopening. I'm happy to try and answer those questions as best I can without an entire team here. Things are moving at lightning speed, as everybody knows. But if something's not covered here, I'm really happy to take any questions at all. So we'll just go through this. So this is our data tracker. So hopefully everybody on the call today has been to our data tracker. I know last year, was it last year we were here already? We were plugging the data tracker as well, but it is, I mean, leagues above where it was at last year. Like really the epidemiology team that manages this tracker is constantly looking at ways to make it better. Not to toot our own horn here in Durham, but we have an excellent data tracker. So if you haven't been, I suggest you go. So it's just durham.ca/COVID cases. So I think when we were here last year, we were looking at, it was in the spring, we were looking at our cases and we were showing just the left-hand side of the screen here, right? And we thought the cases were extremely high and like, you know, look at what we've been through. And then we take a step back now and look and say, oh my goodness, right? So when I was presenting a few weeks ago, we were sort of at the crest of this third wave here, but you can really see now we have crested it. We're sort of looking over our shoulder and saying, yes, it's coming down. And comfortably, we're seeing cases come down. The big success story here, you'll note on the left-hand side and in the middle in those two waves, there's quite a bit of blue, and that's long-term care home and retirement home staff and resident outbreak cases. And you may notice that there's really very little blue in this third wave, and that is absolutely due to vaccination of long-term care and retirement home residents and staff. It's sort of a miracle story, actually. When we were still having cases like those huge spikes, you can see we still only had 2-3 long-term care and retirement home outbreaks. So it's really amazing to see hundreds of cases in the community, not bringing that into the homes. So this is always there for you, you to look at on the data tracker. Tells a nice story. So here's the current status of our cases. So on our main data tracker page, right away, you'll see all this information. And I really like this little rectangle graph here, because although I like the trend, I like to actually look at the cases coming down. Bit of a spike on the 21st, but again, the trend really shows that we've been under 100 for the past few weeks, which is really wonderful. And our outbreaks, like I mentioned, there's only 3 right now in long-term care, retirement homes, and hospitals. School and childcare, no surprise, only 1 of these are school outbreaks because schools are out. Some children are still in schools with certain needs. They're in school in person. So I think we only have 1 school outbreak right now, and the rest are childcare. No surprise, childcare is open. There's going to be outbreaks if there's cases in the community. And then we're only managing 8 workplace and community outbreaks. So really, this is manageable. And right now, we've had over 24,000 cases of COVID-19 within Durham since the beginning, and we're still managing over 1,000 active cases. Unfortunately, there's 51 people hospitalized as of 2 days ago. Our data is always a day behind, and there's still 21 people in the ICU. So we're not out of the woods yet here in Durham. So here, we're so proud of this addition to the data tracker. So on the main data tracker, you'll see a toggle for vaccination, and it'll bring you to this page. Or we have a direct URL, durham.ca/vaccine tracker. So please bookmark this. It's really great. It's updated every day. We're very proud that we've already given over 360,000 vaccines. And this is with our partners at Lake Ridge Health because they had vaccine first. They had a special freezer. They were able to take vaccine from the province right away. And they got the ball rolling, getting out into the community with vaccinations. And now we have our primary care partners. You can see there are almost 5,000 vaccines. And our pharmacies just got added last week. Pharmacies are completely separate from the health department, sort of a province to pharmacy. So it just took a little bit longer to get that information. And then it shows you here our mobile clinics with our paramedics. They go out. And then our hotspot clinics as well. So really this tells a great story. You can see we're still on this trajectory of increasing. So still on vaccine administration, how many vaccines we've given out with our partners. There's on the main data tracker, there's a little toggle on the left-hand side, and you can play with it, which is what I'll show you next, which is here. So you can look at the first and second dose. So no surprise, we saw some second doses given early for those who live or work in long-term care and retirement homes. And now we're trying to see the second doses again with that dark blue for people who've been sort of bumped up into that the earlier second dose category. So it's high-risk healthcare workers and certain individuals with certain health conditions. So as more vaccine comes, you'll start to see more and more of the dark blue for second dose as more groups get added to the ability to get their second dose a little bit earlier. So here's by administration site, not by site on your body, like where you got the vaccine, but where the vaccines were given. So as you can see here, it's mostly health department community clinics as well as our hospital partners. So Lake Ridge Health runs our Oshawa site, which has been tremendously helpful in one of our pop-ups. And then you can see the hotspot pop-ups in green. The mobile is smaller, but it's in there. And our mobile team does a lot of housebound frail, our community living, sort of our more group home type places. So it's smaller, but it's a mighty group doing very important work. And then pharmacy, you can see here in the violet. So they've come on and they've done a great job locally. And then primary care. So I love this slide, tells a great story. Again, it's just on that main vaccine page. And this will continue to rise, as you will see. This tells an interesting story about the type of vaccines we've given out. So as you can see, AstraZeneca was paused. They're in the purple. So you can see that's obviously slowed. And then when people get their second dose of AstraZeneca, you'll see a bump again. Moderna is ticking along nicely. And obviously Pfizer is what we have the most of. So it's continuing in blue. So that's it for vaccine administration. And now we have vaccine coverage. So on the same website, we do vaccine administration and then vaccine coverage right under it. And this is really great because you can pick out your own municipality and see. So the coverage is a little different than what we administer because the administration, we control that data. It's we gave you a vaccine and you count as one. But here vaccine coverage is anybody in Durham who's received a vaccine, but your address is in Durham. So for example, if you work at a hospital in Toronto, we would capture you here as receiving a vaccine because we have the postal code, but we haven't captured you as giving a vaccine because we haven't given it to you. So that's why those numbers won't always match up. But it's great here. So you'll see on the top right corner, 60% of those 18 plus in Durham have received at least one vaccine. That is excellent because that's everybody down to 18, right? So you'll see here You know, in the 80+ crowd, it's over, you know, almost 84%, 77.9, almost 85%, over 60, almost 80%. Like, these are excellent numbers. Where I'm very happy with this. And then as we start to see more and more vaccine available to the younger groups, I'm certain that the percentage will increase in Durham. And we don't have we've seen some numbers, people say they want 70% coverage of 80+, or sorry, of 18+. Some say 75, 80%. I'd be thrilled with 90%, but we'll see if we get there. But we can talk about what that looks like for reopening too. So here on the right-hand side, we have vaccinated by municipality. So we'll just break that down a little bit more. So here you can pick, so it's not on here, on the webpage, it's right below, you can pick your municipality, you just pick it from the map, and then it highlights for you. So here for Ajax, we can see that for people over 18+, 67% have already received one vaccine. So if we think about that, we haven't had vaccine down to 18 for too long now. We've had it a little bit in the hotspots, but we're doing really well in Ajax. I'm happy with this number. And then you can see the breakdown for Ajax a little bit more on the left-hand side. So the youth in Ajax are youth, you know, once you crest 40, I think everything in your 20s is youth. But the 18 to 29 group, I mean, look at that vaccination rate, like that's really excellent. So the next is Pickering. So again, you would just click on the map and you'd see Pickering. So again, with Pickering for 18+, almost 70% of those 18+ have already received one vaccine. So again, this is excellent. Still working away, but it's excellent. So here's our vaccine plan. So sometimes we learn about what's happening in the vaccine world through the media releases, and it is what it is. But right now we're sort of on the tail end of phase 2. Phase 3 is when it's sort of summer and vaccines available constantly, so we're almost there. But right now it's residents 18+ across all of Durham, so anybody can book into any of our mass immunization clinics. We're at the tail end of focusing on the hotspots, and that was where we brought in mobile teams and pop-up hotspots, and then the fixed hotspot at the Ajax Community Center. So we've really put a lot of vaccine into Ajax and Pickering through that hotspot work. Essential workers who are 16+ can receive vaccine, all Indigenous adults and adult household members, and then the highest risk, high risk and at-risk health conditions and faith leaders. But right now it's open to 18+. So I know there'll be questions about what's happening with the 12 to 17 group, and that is an excellent question. So 2 weeks ago, we were advised by the province, and there was a news release that we would need to work with our school boards and local adolescent student partners to start vaccinating the week of the 31st. And we had already planned on doing some hotspot sort of pop-up mobile the week of May 24th. And then you may have seen on Friday at 3 p.m. the province announced that many health units were going to be opening right away to those 12 and above. So we don't have extra vaccine in Durham. It would be great if we did. So we are scrambling. Everybody worked very hard all weekend and still frantically working to figure out if there's vaccine anywhere that we can sort of divert to the 12 to 17 group. So we hope by the end of the week, this is a possibility. Maybe by the end of today, tomorrow we'll have a news release about what that looks like. So I'm sorry I don't have that yet. We are working our very best. So more to come on that, but hopefully it'll be soon. And those 12 to 15 who've been at very high risk have been able to access our clinics already with a referral through their primary care or specialist physician and nurse practitioner. So it's been accessible, but just not widely, because until last week you had to be in a high risk category under 16 for Pfizer to get the vaccine. So these are hotspot communities of interest to Ajax and Pickering. It was on here, I'm sure everybody knows about the hotspots. These were provincially designated. We were already interested in Ajax and Pickering through the high priority community strategy, which was designated by the province back in December. So the main community agency there is Curia Community Health Center, and assisting with testing and wraparound services. So when they came out with the hotspots, we weren't surprised. And 2 weeks ago, we added one area in Oshawa. We added L1L. So we've actually finished with our hotspot pop-ups and mobile for the most part in Ajax and Pickering. And we also have no additional vaccine now. So we have to, because we got more vaccine to do the hotspot work, and now we don't have any more. So we've identified the L1L area, so we're diverting more vaccine there to the Oshawa clinic at Durham Tech, Oshawa Tech. Okay, so just as I mentioned, what we were doing in the hotspot vaccine strategy, we had our mass immunization clinics in Ajax and Pickering. We had the rotational pop-up, so that was the health department group that went out every Thursday, Friday, Saturday and offered a clinic. So it was like a fixed semi-fixed pop-up. And then we had our mobile group with the paramedics that went out. And then we have the Oshawa Clinic at Ontario Tech. And then the Ajax Community Center was what we had for the last month. And that was every day. I think they just didn't run 2 days out of the month. And again, diverting lots of vaccine there. And now our pharmacies and primary care are on board. And every day when I check the pharmacy site, I find more and more pharmacies that have come on board with Pfizer. So the best thing to do is you just Google pharmacies Ontario COVID-19 vaccine and put in your city. Like I was on Ajax this morning just looking, and there's more since yesterday, I swear, of pharmacies offering both Moderna, so 18 plus, and then Pfizer, 12 plus. So really lots of good access is coming. And then the roadmap to recovery, everyone on the call probably has just as much information about this that I have. So hopefully we hear more soon. But this came out last week, and this will be based on key indicators of which vaccination is one. And they haven't announced the actual date that this will start yet, but they're hoping to start the step one, which is the yellow orangey here, the week of June 14th. So once everybody has 60%, all 18 plus have one vaccine, which in Durham we do almost across the region. Then 2 weeks after that, we will enter step one, is what is my read of it. And then more things will open, parks, day camps, and then we just continue. And each grouping will be 21 days to give enough time to see a response. So I wish I had more information on roadmap to recovery. I don't yet, but our Durham region reopening toolkit will have all of this information, and there's already some new information for local businesses and partners. Hopefully you've all bookmarked that site as well. And that's it for me. Happy to take any questions. I'll hand it back over.
Thank you so much, Dr. McTavish. That's fantastic information. Really great to see some local numbers and what's been happening here in our communities. There was one question in the chat, and again, I should have mentioned beforehand, everybody, should you have any questions for Dr. McTavish or any of our presenters throughout the session this morning, please feel free to enter them in the chat, and we'll shoot them over to our panel. First question that is in there, about AstraZeneca, the second dose, will it be available in Durham region, or is that a provincial directive?
So all the vaccine that went to pharmacies was from the province. So we don't have AstraZeneca to give out at the health department. So as of the news release and the information that came out last week is that people need to go back to where they first received their AstraZeneca vaccine, whether that was at a pharmacy, and some primary care providers and physicians had it as well. So it's available where you received it the first time, so certainly it's available. And we understand that there'll be information coming soon from the National Advisory Committee on Immunization about if you can take a different vaccine. So let's say, for example, you got AstraZeneca, but you're thinking use like a different vaccine for your second one, that guidance will be coming out shortly. But you'll have to, for now, you have to speak to who gave you the first AstraZeneca, whether that was your pharmacy or your healthcare provider. Okay, perfect.
I have a couple questions written down, and again, if there's any, just put them in the chat for Dr. McTavish. You just mentioned we don't have a ton of information about the reopening plan that the province announced last week, but there are some numbers. First, let's be clear that those percentages, the larger ones, are for first doses, right? So 60% of those of us who have our first dose, and so on and so forth. What, in terms of the region, are our expectations of timing for when most of us will have our second doses? Or
well, that's an excellent question. I can't answer it. But as soon as there's more vaccine, like already we've seen, for example, you know, a few months ago, if you lived in long-term care or retirement home, you were able to receive your second dose earlier based on the product monograph. So sort of what they did the research on, right? And then as more vaccine, so then they bumped out second doses for everybody else. And as more vaccine comes, they're able to bring people back sooner to that early second dose. For example, 2 weeks ago, high-risk healthcare workers were added back into that group, as were patients who were on dialysis. So as soon as there's more vaccine, they look at the science and they say, who should come forward? And we're not sure yet if that's going to be age-based. For example, when they get a large volume of vaccine, did they say, okay, everybody over 90, then 85, then 80, or are they going to say certain health conditions? Maybe certain people at work, for example, maybe teachers, school is back, it'll be bumped in. So that's an excellent question that I also don't have an answer to. But as soon as more vaccine comes, you'll see people starting to get into that that shorter group, but it's interesting. It's actually fascinating. Vaccine science is so interesting. It's way above my head, most of it. But there's some research saying that actually the longer you delay, not longer, not years and years, but if you bump it out a few months, you actually might have better protection. So the team who looks at this, at the national level is examining all of this data and making recommendations. And I can certainly say, I trust the recommendations. My second vaccine is, late summer, and I'm content with that right now.
Okay, excellent. So it really is entirely dependent on vaccine supply and how much we can get into the region time-wise.
Yeah.
Fantastic. Another question from, I don't have a name, but Rankin, someone with the last name Rankin perhaps. Any concern at this time about getting to step 3 or the 70 to 80% vaccinated? Will promotions change if we stall?
So that's also a great question. So in Durham, we haven't really seen any hesitancy yet. So for example, like York region and Heath, they've been able to drop down to 12 plus already. And we are really struggling to do that just because our uptake is still so high in all those age bands. So I'm certain we'll see a little bit of hesitancy. We haven't yet. So I think when it comes, we'll have to think about what our strategy is going to be. And that's obviously going to be a national and then provincial and then local targeted strategy. So we are already working with community partners. For example, in 2 weeks, we'll be offering like a Black resident of Durham specific community clinic. And we've offered vaccines already specific to certain mosque communities and other agencies where they feel that their vaccine coverage is low. So we're already working with community partners and happy to do that. We've done that with our faith-based leaders. And it's interesting, some workplaces are contacting us saying, oh, we think we have low uptake. And then when they actually go back, they say, oh, actually, 85% of our staff have actually, already received their first vaccine. So if anybody, whether it's like a workplace or somewhere you are engaged in the community and you think that your uptake is low, please email me. Put my email in the chat or whatnot, and we can certainly work with people to determine where vaccine is low and sort of think about bumping that up. So we've been focused not completely, 99% on the mass immunization clinics. The mobile team's doing great work, and then we're going to have to turn our attention soon to where uptake is low and how do we sort of address that. So we're doing that in the background right now and putting the pieces in place. But we have the mobile team who's excellent. They just sort of pop up wherever you need. An example is a faith-based community.
Right, and that's fantastic news. Great to hear, because I know many of our members who are larger employers are interested in how they can help with getting their employees vaccinated again, just so we can reopen safely and keep everybody safe while they are open as essential workers too. So thank you. And
so I do think we can get to the third stage. I do, the 70 to 80 in Durham. Like we're already over 60%.
Right.
And it's only been a week or so of the 18 plus in Durham. So yeah. I'm very confident.
Perfect. Great. Another question, how once you are fully vaccinated, how long are you protected from the virus? And this sort of ties into a question I had. Do we expect that the vaccine may be a yearly occurrence similar to the flu shot?
So again, that's really an excellent question, whoever asked that. We don't know yet. So will it look like every year we get a booster based on a variant? It is looking that way a little bit now just because we keep seeing so many variants, and that's just what happens with coronaviruses. They mutate a little bit. But we all know that because cough and cold season, right? Every year we tend to get more cough and colds, and we say, how do I have another cold? I had 2 like last winter. It's just because of little mutations, right? You get another sort of strain of it. So we already experienced this. So is that what this is going to look like for a few years? That's what some of the experts are saying now, and some of the modeling for a few years we'll have to have a booster. And I understand with the mRNA technology, you can make a booster to a variant of concern really quickly, like within a week. Like that again is just unbelievable, right? We had a new disease, now we have vaccines against this disease. Like it's really incredible what's happening. So that's the thinking now, is that for the next few years, we may need a few little boosters, whether 6 months, once a year, until sort of the entire planet sort of gets, COVID-19 under control, in which case maybe we won't at all. And we'll sort of just see a small seasonal pattern like we do now with influenza. So that's a really great question. We'll just have to sort of wait and see, but that's what people are thinking now. Yes.
Perfect. Thank you. In Canada, have we announced people with 2 doses can stop mask wearing? I don't think we have, but I'll ask you.
Not yet. Great questions. I know the CDC came out with that a while ago now, and we were pleasantly surprised, I guess, that that came out so quickly. But there were pockets in the States that actually had a very high vaccine coverage already where we didn't. In Canada and Ontario, it's sort of been, it's just been a different strategy, right? We're sort of targeting those higher at risk. So it's been a little slower, but we're targeting vaccine to where it was needed first. So we'll get there. We're not there yet, just because we're still just at 60%, but we're really hopeful that once we get the higher coverage, restrictions can be lowered, perhaps mask wearing will decrease. But it's really interesting. We have a really great flu tracker as well. And, there was 2 cases of influenza in all of Durham region this year. I mean, there's influenza we may not catch because you have to be symptomatic and we don't test everybody with symptoms. That's not how testing goes for influenza, a little bit different than COVID. But 2 cases in Durham region, like that is really, it's actually unbelievable. And it's because of all the other precautions we're taking for COVID. So the thinking is, can we even go back to that? Do we even want to go back to maskless when we think about, how many outbreaks we prevented in long-term care, how many deaths we prevented? So although we may not go back to normal, it may end up being a new normal where, during cough, cold, flu season, we're wearing masks. So we'll have to wait and see. Yes, we should see restrictions, many restrictions decrease once we get to that higher percentage for sure.
Right. And so we have time just for 2 more questions, one in the chat. The last one here is there any more information on the vaccine and its effectiveness on the variants?
Also a good question. So that information continues to evolve. I swear every day there's a new paper about that. But yes, it's looking more and more like Pfizer is doing an excellent job for new variants. And AstraZeneca certainly is having good coverage, and same with Moderna. The bigger papers are really Pfizer, just because more people are getting Pfizer globally. But there's great research out of the UK. Almost everybody in the UK got AstraZeneca, right? They did a good job against the variants. So we think the information is more hopeful than we thought originally when the variants were coming out. But we'll have to wait and see about the new variants, right? Because sometimes the variants sort of start in an area that doesn't have the vaccine, and then we have to just sort of merge them where people are getting the vaccine when the variant comes. Right. But certainly you just need to take the first vaccine that's available to you. And if a variant comes out, then we'll need a booster next year. Perfect. But so far the vaccines are doing a pretty good job against variants.
Good. Thank you. And then last question, just from me, from your opinion or your perspective, the outlook for the end of 2021, the fall season, do we see maybe some more coming together in terms of events, some more in-person activity? What are your thoughts?
Yes, I think once there's a good deal of vaccine, people have had COVID, so they might have a little bit of natural immunity, but interestingly, your immunity seems better with the vaccine. So people say, oh, I had COVID, I don't need to get the vaccine. Incorrect. It's a totally different mechanism, which is actually fascinating. So if you get the vaccine, you're more protected than if you already had COVID, which is different sometimes than what we think about for illness. So I think by the fall, people are going to have lots of vaccine. People are going to be so used to the public health measures. They're gonna enjoy the little freedom, like being able to do the smaller bits and sort of take that next step, that everyone will sort of understand we can't go past this. We're doing such a good job and we'll just keep doing it. So I am very confident that the fall is going to look very good.
That is fantastic. Thank you so much. I got some goosebumps. I'm looking forward to that time of year as well. So again, Dr. McTavish, thank you so much for your time this morning, for your expertise. You're right, vaccination science is absolutely fascinating. It's crazy what's been happening in such a short amount of time, and how we've all sort of come together to battle this locally, provincially, in our country and across the world. And again, we thank you for your time this morning, and I'm sure we'll see you again very soon.
That sounds good. And I'll stay on till the end in case there's more questions.
Sounds great. Thank you so much.
Thanks.
All right. So changing a little bit of direction, our next speaker, no stranger to the Board of Trade, and has been absolutely instrumental in helping our members and other businesses navigate the ever-changing COVID legislation for business and for their employees. From Wilson Vukelich LLP, we have with us today Christine Ashton. There you are. Lovely to see you. Good morning, and thank you so much for joining us.
So happy to be here. All right, so it's hard to follow a doctor. I feel like anything I say is like law, but it's not as cool as science and all that stuff, but here we go. And I am happily vaccinated, and a friend of mine actually told me that after humming and hawing and being on the fence, she's now signed up to be vaccinated this weekend. So it is great to see the numbers continue to increase in terms of who's getting vaccinated. I'm just trying to share my slide deck, if I could just be given permission to do so.
I think Andrew's working on that in the background.
Do you have this, Christine? Do you have the slide?
Yeah.
Do you have your slides?
I have my slides. It just says when I click on it, host disabled, so I'm not able to share the slides.
1 minute, please.
Okay.
So while we're waiting, I'll just remind everybody, should you have any questions for Christine while she's presenting, please feel free to put them into the chat and we'll ask them at the end of the presentation. And oh, there, and we see your screen now.
Perfect.
So, excellent.
Okay, great. Okay, so what I'm going to be talking about today is about dealing with vaccinations as an employer and trying to push for, ideally, for your employees to be vaccinated. So essentially, unless the provincial government mandates that everyone has to be vaccinated, it's going to be difficult for employers to actually require that all employees be vaccinated. And understandably, as we don't, as we're still learning more and more about the vaccination and about COVID-19, including whether this needs to be a, one and done or an annual vaccination, you can see why there would be some hesitancy on part of the government to just sort of jumping the gun and introducing legislation or regulation in regards to vaccinations in the workplace. Previously, the Ontario government has indicated that it won't be mandating vaccinations, but it still remains possible that the government will, or that it will do it at least for some sectors. So for example, healthcare, within schools, within childcare, and so forth. So if you don't have mandating legislation, then what are you able to do then as an employer in terms of getting your employees to vaccinate? So the challenge here comes down to the fact that we are looking at competing obligations and rights. So on the one hand, you as an employer have an obligation to protect the health and safety of your workers. And that is predominantly from the Occupational Health and Safety Act, which requires that you take all reasonable steps. And these reasonable steps include steps in regards to COVID-19. Now, while the Occupational Health and Safety Act has not yet been amended to specifically address COVID-19, and it may never be, given the fact that we're a year into this and they still haven't done it, it does still have obligations on you in regards to COVID-19 because of the broad language in the Act. So the Act talks about protecting workers from all hazards in the workplace. And COVID-19 is considered a workplace hazard and an occupational illness for reporting obligation purposes because of the fact that it's something that can transmit within the workplace. So you as an employer have these obligations to protect your workers. And it's from that you have developed, safe work policies and training, and you're providing masks and all those sorts of things. So that's the, sort of you as an employer where you're coming from. But you also have to balance those obligations in light of your employees' rights. And there are two main categories of rights in issue here for your employees. So the first is their right to accommodation pursuant to the Human Rights Code. So not everyone necessarily can receive the vaccination for whatever reason, or they may decline to be vaccinated for reasons that are protected underneath the Human Rights Code, such as potentially religion. You also have your employees' right to medical privacy. So an individual doesn't necessarily have to disclose to you that, you know, what type of vaccine they received or that they were vaccinated unless you actually need that information. So you're really only supposed to, as an employer, go into, you know, finding out more information about an employee's medical health or history to the extent that you need to in order to satisfy your obligations as an employer. So it is very much a minefield of potential missteps for you as an employer when you try to navigate ensuring that your employees are vaccinated. So obviously this is our first time with COVID-19 and our first time in about 100 years of dealing with a pandemic of this sort. That being said, there is still some helpful case law that gives us some guidance in terms of what employers can and can't do when it comes to mandating vaccines. And no surprise here, a lot of that case law involves hospitals. So two of the main leading decisions that are relevant, one involves St. Michael's and the other involves the Sioux Area Hospital. And in both of those instances, the hospital was trying to impose what's called a vaccinate or mask policy. Essentially, if you don't vaccinate for whatever reason during the flu season, you would be required to mask. Now, as Dr. McTavish was just mentioning, I think that all of us going forward will probably still just want to mask anyways during the flu season, even after we're vaccinated. But in any case, in these cases, the hospital is trying to ensure that if you aren't vaccinated, that you mask. Now, obviously, a policy like this creates some concerns for employees in terms of their right for accommodation and their right to medical privacy. So, for example, just picking up on the privacy point for a moment, if you require that all your employees who haven't vaccinated be masked, then the mask is a very clear way of letting everyone know in the workplace that for whatever reason, they are refusing to vaccinate. Sort of like a scarlet letter, as it were. So the arbitrators in those cases struck down the vaccinate or mask provision, stating that it was an unreasonable exercise of management rights and in a breach of an employee's privacy rights. But these decisions also made it clear that when they were thinking about whether the appropriateness of the policy, they were looking at it in terms of a preemptive policy during a non-outbreak. So it is very possible that despite these decisions, in a situation such as the one we find ourselves in now, a policy could be found to be enforceable by an arbitrator if you're a unionized employer, or by the court if you're, or human rights tribunal if you're not unionized. But in ensuring that any such policy is enforceable, as an employer, you'll want to make sure that you're mindful of, is it reasonable? Am I going as far as I need to go without going too far? Am I taking all steps that would protect the individual's privacy? So, for example, a policy that requires individuals who don't vaccinate to wear a mask can be seen as an improper intrusion on privacy. But perhaps a policy that requires individuals to work remotely until they get vaccinated might not be seen as necessarily that sort of intrusion if there's other individuals who are working remotely for other reasons, and therefore not sort of singling out those individuals. But in light of that case law, you can definitely see that it's going to involve sort of a careful balancing of why is vaccination so important in your workplace? What are you looking to protect? What steps are you going to have in place? How much medical information are the employees going to be required to disclose? To what extent is it going to be clear to other employees then what their medical information is? And how are you going to accommodate things such as a disability? So, for example, if someone is not vaccinating because of religion, but also can't wear a mask because of a disability, what are you going to do about that? So it is very possible that you could have a vaccination policy upheld, but it needs to be very carefully drafted. And you need to sort of think about all those types of hypothetical situations when you're determining it and figuring out why exactly is this vaccination policy important to us. If, for example, you're a pediatric dentist I could totally understand why a vaccination policy is going to be important to you because of this, you know, the nature of your workplace. Whereas if you are within manufacturing and everyone, you know, you have sort of herd immunity, you have a sense that at least 75% of your workers have been vaccinated, and everyone in the workplace is required to wear a mask anyways, then perhaps a mandating vaccination policy is not required and wouldn't be seen as reasonable. So overall, what should you be doing as an employer then in regards to vaccination? So one, you want to promote vaccinations, and you can do that through obviously posters, you can send out emails, you can even, I had some clients who were reminding employees of this new sick day pay in regards to COVID-19, which includes 3 days pay in relation to getting vaccinated. You can even provide your employees with an additional pay beyond what's provided for underneath the new COVID-19 sick day pay. You can make sure that you're sharing and properly implementing COVID-19 safe work policies so that people are staying safe whether or not they are vaccinated. You can ensure you have in place your COVID-19 visitor policy so that when visitors, clients, customers are coming into your workplace, they're safe and your workers are still protected. You can make sure that you're putting up all the COVID-19 related posters, and the Durham region has a really great website where they go through all these sorts of material for employers. You can make sure that you're addressing physical distancing, PPE such as masks, and other issues in the workplace. You can make sure that you're holding Zoom sessions where you're speaking to your workers about exactly what they're supposed to be doing to protect themselves and others. And then you can be checking for compliance. So that could just involve, you know, once a week, once a month. Just walk through to make sure that everyone is in fact complying. So short and sweet, but essentially those are my slides in terms of dealing with vaccination in the workplace.
Thank you so much, Christine. And there are a couple of questions in the chat, so I'll read those out to you. And then again, if anyone else has any, feel free to enter as we have this little conversation. So from Chantel Giroux, she's asking if any employer is now mandating their employees to get vaccinated, depending on future legislation, are they going to be liable for complications such as severe side effects or death, considering the vaccine companies are not?
So when you require, a lot of employers right now, there's no employer that I'm aware of right now that is necessarily going to force everyone to be vaccinated. There's definitely a lot of employers that are watching it right now and are contemplating potentially putting it in place in the future. Most employers, though, are looking at doing things like implementing rapid testing and antigen testing in their workplace. And all of those employers that I know of that are doing that do require for their employees to sign off on a waiver as part of the program. So remember, again, you are trying to strike a proper balance in terms of ensuring that you're respecting privacy and the human rights, while at the same time pushing for vaccination. If you're not doing the vaccination yourself, in my mind, the potential consequences or side effects that a person might experience from being vaccinated, it's not something you'd be liable for. Because again, the policy should provide and will have to provide that they aren't required to get vaccinated, but that something will happen if they don't get vaccinated, right? And it could be that they have to work remotely or something else, right? But it's not that you're forcing them, like you're not standing there, like sticking them with the needle, forcing them to do it. In any case, we also have legislation that's come into place regarding COVID-19 liability. And essentially underneath that legislation, if someone suffers a consequence in regards to COVID-19, the ability for them to sue someone over it, such as their employer, is extremely limited, whereas the employer essentially would have to be acting, you know, in a brazen and unreasonable manner in order for them to be held liable. So it would have to be like, not only are you sticking them with the needle, but at the same time they're screaming, my doctor told me not to do it, I will have an adverse reaction, and you do it anyway. So the liability there is incredibly low and unforeseeable in my mind.
Okay. And so I know that a number of our larger businesses in the region are interested in hosting employer vaccinations on site, employee vaccination clinics on site. And so if they were to sort of travel down that road and do so, they still can't mandate their employees to get vaccinated. It would really just be for those who are interested in doing so.
Correct. So what I recommend doing is, well, first, just to pick up on your slip there, employer vaccinated. First, if you are an employer, go and get vaccinated. Nothing makes it easier to show that you're comfortable with it and support it than telling your employees that we, the owners, have all gotten vaccinated ourselves, right? But in terms of holding it at the workplace, so I understand the province has been in discussions and some employers are on that list of getting to have worksite-based vaccination clinics. And I expect that in the coming months, as the vaccine supply becomes more and more stable and predictable, that we'll probably see more instances of workplace-based vaccinations, and hopefully more, in particular for those with shift workers who aren't necessarily always able to go and get vaccinated during that 9 to 5 window that we normally see for clinics. For those places, just like they're doing for the Antigen site, my recommendation is that employees be first sent out a communication that makes it clear, you know, exactly what's happening, that we're going to be doing a vaccination site, that we're promoting everyone, explain the reasons why it's so good to get vaccinated and so important for everyone to get vaccinated, and then also confirm that it's optional. You're not required to do it. There's not going to be a punishment if you do, that sort of thing. So I recommend that that communication go out beforehand. I recommend that you also be mindful of the language that your employees speak. So for example, if you have a workforce who are predominantly ESL, then perhaps you consider sending out that communication in other languages. Because oftentimes what people do is they go home and they'll speak with their family members, and if they have something like a poster or handout that they can show their their family members, it allows for a better dialogue and discussion and an increase in likelihood that everyone's going to sign up for it. So I recommend that that communication go out. And then if you want to feel more comfortable and confident as an employer doing this, you may have your employees sign off on a declaration. And that declaration confirms that they are agreeing to the vaccination or the antigen testing, and that they are waiving their right to sue you as an employer in regards to that. And so that makes sure that down the road, no one can suddenly claim that, you know, they thought they were forced to or whichever.
Right. That's fantastic advice. Thank you. Speaking of, you mentioned antigen testing. Can employers require employees to take those tests?
So again, no, I don't recommend that you require that your employees take the antigen testing. It should be optional, and that should be clear to them in the communication, because you're trying to balance those obligations, right? And so unless there is no workplace in my mind right now that employees have to do that test in order for it to operate safely, right? So because of that fact, you shouldn't be requiring employees to take it. It should be optional. And because not everyone's going to take the antigen testing, and because the antigen testing isn't 100% effective, it's not as though, you know, let's all take off our masks and just go and get an antigen test, because it's not effective. 100% effective. We're still going to have those measures and policies and procedures in place that are going to protect everyone. So we just want to push, you know, all employees working together to help save lives, while at the same time keeping in place those other measures that we need to have in place to help save lives. Okay,
thank you. And another question from Joan Weidman. How were employers able to confirm to the region that they had 85% vaccination completed in their employee groups if we're not allowed to ask employees?
So I think you can go ahead and ask employees whether or not they're vaccinated. I just think that you need to be very clear in that communication that employees don't have to answer, right? For most of us, if you've ever done, any sort of census-based or survey-based questionnaire, normally your options are yes, no, or I decline to stay. And that's my recommendation, is that if you want to take a poll of your employees to determine whether or not they have been vaccinated, that you give that sort of option, yes, no, or I decline to stay. But another great way of pushing employees to telling you whether or not they've been vaccinated is to remind them of that sick day pay entitlement. You want those 3 days pay, you got to tell us if you've been vaccinated. So those sorts of monetary incentives might be something that you can use as an employer to push for it. At the end of the day, if you do the survey and you also pay the sick day pay, you can then use what you learned from the sick day pay to sort of top up your knowledge in terms of the survey and overall uptick in terms of whether or not you are achieving herd immunity within your workplace.
Fantastic. And last question, so speaking of encouragement, obviously that's the best way to go. Continue to encourage your employees to do this, to stay safe, to keep all of our other employees safe. Are you seeing any interesting or out-of-box thinking ways from employers who are doing that, getting their employees out and vaccinated? I've heard, again, paydays, sick pay, or giving, like similar to voting, you get a certain amount of time paid to go and get your vaccine. Anything else employers are doing?
So I think in large part it comes down to, really helping support the employee's comfort level with job security. I think that's the number one thing, is that making sure that the employees understand that if they go out and they get the vaccine and they have a side effect and they need to be off for a few days, that they will be supported, that their job is not suddenly going to become on the line. So it's really important to make sure that's clear. And part of that is to emphasize, that you're either going to have the sick day pay entitlement mandated by the government, or you're going to have something that's even better than that through our company. And then you also want to look at even shift scheduling. So for those employers that have 2 or 3 shifts, whether or not you might want to consider doing a shift swap so that employees are able to go and get vaccinated. We've certainly seen some regions offering clinics at different times. And, I'm sure everyone's aware of the Mississauga one that was like 24 hours. So we're definitely seeing more flexibility and ability for individuals to get vaccinated at off time. But those are some of the ways that I've definitely seen it. I know a lot of clients of mine are now starting to put up posters in the workplace too to promote vaccination. And I hope that more regions are looking at creating, we saw that like last summer, how many gooses apart do we need to be? Mm-hmm. So hopefully we'll see some more pro-vaccination posters that employers are able to use to put up to spread the good word.
Excellent. Thank you. Great advice. And to everyone tuning in, Christine is always available to answer questions. And I know you and your colleagues have been continuously through this whole year and beyond running webinars and certain things on all sorts of topics related to COVID-19 and employment, employers, employees, etc. So I encourage everyone to check out their website and upcoming events, because they are very, very helpful sessions. Thank you so much, Christine, again for your time this morning. I hope you have a fantastic day, and I believe you'll be sticking around in case you have any more questions at the end of the event. So thanks again. See you soon. All right, that is Christine, Ashton, everybody. And so now we're going to be moving on to our final speaker, who is the President and CEO of the Ontario Chamber of Commerce. There he is. Rocco, I'm so happy you were able to join us this morning. The OCC continues to be an incredible resource for our organization and all the chamber network across the province. Of course, you are the true indispensable partner of business, and we just welcome you here this morning. Welcome. Hi.
Hi, everyone. And look, the people who are truly indispensable are all of you, because we're only as successful, we're only as influential as we are made by the fact that we have 140 chambers and boards of trade in every corner of this province, representing over 60,000 businesses. And that's really the voice and the weight that we bring, and the great ideas, and thought leaders like Christine, who have just been huge in our thinking on a number of files as well. And delighted to see that Ajax-Pickering will also be joining in on the free antigen testing distribution to SMEs under 150 that we, together with the Ontario government, the federal government, our federal partners, the CCC, have managed to begin, because the federal government generously bought a gazillion of these tests, and they're doing no one any good in warehouses. So as Christine points out, they're not 100%, but if you do wide screening multiple times a week over time, they have been shown to break spread of asymptomatic people. Nova Scotia, which was out front on rapid testing, over 10% of their identified cases were caught through rapid testing. So it is an important and effective tool. Look, the law, like the science, is evolving, and I don't want to contradict, because I'm neither a doctor nor a lawyer, much to my mother's disappointment in me. But while I don't have a crystal ball, I do have the opportunity, as we all do, to look into the future by looking at other jurisdictions that are ahead of us, right? And what do some of what they're doing suggest may be coming here? And I'm a huge believer in the old saying that the best way to predict the future is to create it. And so a few months ago, we stood up the Ontario Vaccination Support Council. Over 250 businesses, colleges, universities, associations, and labor unions came together really with one goal in mind, and that is, how can we accelerate the rollout of vaccination as quickly as possible by volunteering, donating, doing whatever we could. And huge progress, everything from, Oxford Properties donating the Scarborough Town Centre to the Toronto Public Health Unit to put a mass vaccination site, Centennial College, Brock, Guelph, Seneca College standing up mass vaccination sites together with their PHUs. We've had companies step up and provide funding for free cab rides to and from vaccination sites, again, trying to ease things as much as possible. And Christine laid out a few other examples. Lead by example, making sure that leaders are seen to be vaccinating themselves to encourage and send that notice to everyone by example. And beyond the take time off, there are lots of our members who are actually assigning someone in HR from the larger companies, but a parallel can be done in smaller companies, where they just say to employees, look, I know that you may not have broadband access at home, or you may find it confusing to go through setting up an appointment. We will provide you with a resource during work hours to make sure that you get your appointment set. And that's another way. You're not forcing anyone, but you're trying to reduce those barriers, and by encouragement, get more people involved. What I don't like about the case law, in a sense, or the discussion and how it's set, is this notion that it's employee versus management. It's actually employee rights versus other employee rights, is the way I like to look at it, because I have even members in my own team who have are either themselves immunocompromised or have members of their family immunocompromised. and have gotten vaccinated, but say, I'm not going to be coming back to the office if I can't be certain that everyone is vaccinated. Because vaccination in and of itself isn't 100%. And so you're going to have to weigh not just employee rights and liabilities to the individual rights of an employee to say no, but the rights of every other employee to safety, the rights of all of your customers to safety. How many people are going to want to go into a barbershop, a hairstylist? Sadly, those days are long past for me, but not having certainty that the employees they're going to encounter have been vaccinated. And that's not even to mention the health folks. So interestingly, and looking at the future in other places that are dealing with similar legal frameworks, Brown University and Columbia University have already announced that you cannot come back physically to campus, whether you're an employee or a student, in the fall unless you have proof of vaccination, 2 doses, period, full stop, right? And maybe they get challenged in the courts, or maybe this is the beginning of this weight of not simply weighing the rights of employers and management, but employees with the greater community, because we're dealing with a global pandemic. And to Christine's point, the last time that case law was tested was 100 years ago in the global flu of 1918. So interesting work still to be done there. International travel, right? You may be able to skate and say, well, I'm not going to get vaccinated here, but try going to another country. That is going to be very difficult. And you're seeing already announcements in the EU, et cetera, that they'll only take travelers from certain countries. They'll only take travelers with proof. Portugal is saying it's not even good enough to have photocopies of your receipts of vaccinations. They want the QR code that hooks back to electronic records so that they can confirm it, because you know what? People lie. And people fake documents, and countries are freaked out appropriately by the carnage that this virus has caused and continues to cause around the world. And quite frankly, are not going to accept that, show me in the Quran and the Bible where it says you cannot get vaccinated, right? Like if you're going to try to play that card, you're going to have to be really, really specific, and they're still going to have issues. Israel, far and away the farthest ahead on this, and are effectively distributing internal vaccination passports so you can go into clubs, proof that you've been vaccinated before you go in. And the notion of, if you can require no shirt, no shoes, no service, imagine what is going through people's head on the vaccination side. And again, that's for other employees and customers as well. What do we do in the meantime? Some very positive news. Canada has already overtaken the United States in terms of percentage of first-time vaccination, 1 in arms. So yeah, we started far slower. We've had supply issues, but there seems to be far less hardcore anti-vaxxer and hesitancy in Canada than there is in the United States. And I think we want to do everything possible to continue to encourage that move forward. The polling that I've seen, and it's been fairly consistent, there's about 9% Canadians hardcore anti-vax. Then there's about 26 that are on the fence. And that's where a lot of the attention and ideas like the one Christine has laid out. There's also great campaigns that the Vaccination Council is getting in behind. This is our shot. CA, lots of our member companies are actually buying the t-shirts, having management wear it, having people walk through the plant, walk through the facility with it to encourage that, have it in multiple languages, have speakers and thought leaders from wide cultural backgrounds present. And there are lots of electronic town halls you can direct people to. Have a look. I encourage you to look at thisisourshot.ca. Lot of great material, multiple languages and multiple resources. I think the Vax Hunters people should be getting an Order of Canada by the end of this. They're doing phenomenal work. I think for those who are holding out and waiting for maybe more employer site workplace vaccine clinics are going to have to wait a very long time. Everything I'm hearing from public health is with the uptake, and particularly now that it's gone down to 18 plus and below, is a lot of larger employers are seeing that quite frankly there wouldn't be enough demand. And in fact, if you're going to do an employer site, you're going to end up running a community site. It's what Ellis Dawn is now doing out in Mississauga. It's in a hot zone, but in setting it up, they had capacity to do 10,000 over a period of time. Only 1,600 still of their employees and family that needed it. So now they're scrambling to reach out to the community as a whole. And so I think more and more employers are seeing, how do I help the other clinics? How do I help local PHUs with their mobile clinics? And maybe I help to direct some of my employees that way. But the notion that I'm going to be setting it up at my workplace, we didn't do it earlier because we didn't have the supply. Now that we have the supply, it's a little more complicated. So lots to focus on and making sure that we get through. We're clearly continuing to push the government on more details, very encouraged by the 3-stage plan, but there's still a lot of meat that needs to be put on those bones. And they still have the wiggle room because they set the vaccination targets, but then they say, and other key indicators. So if suddenly the ICU numbers are huge, it doesn't matter what the vaccine numbers say. But the encouraging thing, as our doctor expert pointed out, is when you look at the UK, Israel, you don't see a large coming back. The vaccines are incredibly effective. And I particularly want to underscore, because I was one of the 850,000 Ontarians that, listening to health advice, took the first vaccine offered to me. That was AstraZeneca. And I fully intend to take my my second dose, assuming that it all gets sorted out. And the math there is quite simple. There are 55,000 doses right now that expire at the end of this month that they're trying to get out to those who got it in the first week, in the early period of March. There were over 100,000 in that March 11th to 19th period, and only 55. So not everyone is going to get it from that first batch, but 255,000 additional doses have come in that don't have that same expiry at the end of the month. So we expect to see that rolling out. If you want to help, if your business wants to join in the efforts of the Vaccine Council or learn more about it, it's very easy, vaccinesupportcouncil.com, and happy to take any questions.
Thank you so much, Rocco. Your passion bleeds through the screen. I love listening to you talk, as we all should be very passionate about this subject of vaccination. I think it's one of the only ways we're going to get back to before COVID, and so our businesses and our economies can reopen. So you touched on a number of things that I want to just ask a few questions about so we can elaborate. There is one question in the chat about the rapid antigen testing program.
Zero cost. It is free.
It is free. And do you want to maybe talk a little bit about the success we've seen so far? We know that on the west side of Toronto and the Kitchener, Cambridge, Waterloo regions, the program has been absolutely outstanding.
Yeah, well, it had to be piloted somewhere. I mean, when the rapid antigen tests were first announced several months ago, lots of people were saying game changer. Here you can do something in 15 minutes. Let's make it happen. Let's get it out there. But every province still required you to have medical supervision to administer the tests, which meant that for small, medium size, there was just no realistic shot that this was going to get done. Ontario, just 2 months ago, announced that, look, these things are dead simple. As my colleague Ian McLean, CEO of the Kitchener-Waterloo Chamber, says, a well-trained basset hound can take this test. It is a nasal swab, but it's not, the brain tickler. You don't go all the way back. And you swab both nasal cavities. You then put it into a little container that has a bit of liquid, and within 15 minutes, you get a result. If it's positive, you have to get a confirmation PCR test, which is more exact and self-isolate until you do. We decided to pilot in the Waterloo region. So KW and Cambridge, the two chambers, came together with Communitech in the region of Waterloo. And in a 1 month period, over 1,500 businesses signed up, 120,000 tests were distributed, and dozens of chains of transmission were broken. So the federal government and the provincial government said, okay, let's rock and roll. And we agreed in the chamber movement. We thought we'd get 50 chambers maybe interested. We now have 80 and counting, including Ajax-Pickering, that are either in line or already offering it. Businesses order, they go to pick, the businesses pick them up. They agree to test their employees twice a week and to report on an anonymous basis, number of tests given and whether there were positive or negative tests, again, on an anonymous basis, just so that we can get a sense of what positive thing this is doing. We got an initial shipment of over 750,000 of the tests. I expect many millions will be distributed. The federal government bought initially almost 50 million of them. Thus far, they were only used in long-term care and some larger employers. But now with the new self-administering rules, very easy, encourage everyone to get involved. Again, it's not a silver bullet, but it's belt and suspenders, right? And coming back from this, we all know the reopening of the economy is not an on-off switch, it's a dimmer switch. And a big part of that dimmer switch is confidence. Confidence of our employees, confidence of our customers. Every step that we can put in the window enhances that. And I got to tell you, in talking to businesses that have participated in KW and elsewhere, the sense of I'm no longer just a victim, I can actually take proactive action in this is liberating. And it's just been huge. And as I said, there have been dozens of cases of the transmission change because you use these tests for asymptomatic people, right? Someone symptomatic, you don't use rapid tests. You tell them to go take a PCR test, period. They shouldn't be at work. But this catches the asymptomatic, which has been maybe upwards of half of the cases out there.
Yeah, absolutely. And you touched on a piece earlier about, our rights as people to feel safe doing the things we love to do, going to work, traveling. And so I think that's a really important piece to all of this. And one of the reasons why the Antigen program has been so successful, because folks do want to do their part in making sure that they're protecting themselves, their family, and their coworkers. And just so for everyone's knowledge who's tuning in, we have our order placed and we are just waiting for that to be delivered. So looking to the end of this week to start that up and running, the program, or early next week. So really excited to help our business community in Ajax and Pickering and throughout the region. I wanted to ask just a little bit more about the advocacy work that the OCC is doing. A question that was submitted earlier, whether the OCC will be advocating for the province to mandate vaccination for some or all workplaces.
Look, we're not, aside from Christine and a few others, we're not lawyers and don't pretend to be. We, I think, very reasonably are saying to government that we have employees and we have customers who have enormous concerns, and I'm a firm libertarian. I believe in individual rights, but I believe your individual right ends when you put at risk the rights of others, and I think not vaccinating puts at risk others, and that, so on a personal basis, I think this is something I think we should be following the example of Brown University and Columbia and others. So I'd like to understand the scientific reason for not doing it.
That's fair, for sure. And you mentioned the reopening plan that was released last week. And some clarity needed around that. Is there anything specifically you want to mention today that the OCC is asking of the government?
Look, I'm an enormous the glass is half full kind of guy. So I think the fact that there's something there with some real measures is an enormous step forward from where we were, because it's not enough to simply have a stick in managing this crisis. We need some carrots. So people, particularly 15 months in, need to have something to shoot for, need to have a positive reason to want to go out and get vaccinated. So when they see that actually vaccination levels are going to trigger something, because we've been told for months, vaccinations are a game changer. So non-scientific me and a whole bunch of other people reasonably ask, okay, it's a game changer. Tell me when and how the game changes. And it's good to have a first step. Is it aggressive enough based on what we're seeing around the world of what really happens? My hope is that it is a worst case scenario. And in fact, we can get to these things faster, because what we saw, for instance, Friday, Ontario vaccinated over 190,000 people in one day. In one day, right? Well over 1% of the population. So earlier questions around when do we get to 60%? When do we get to 75? When do we get 75 plus 75? Roughly, and assuming that we can keep the pace, every day we're getting another % of the population with one shot. So, if you're at 50, to get to 75 is another 25 days.
Yeah.
And we're basically 4% on second shot. So to get to 75, 4% plus 71 days. And if you can do over 1% on a consistent basis, you start ratcheting that back. So end of August is totally possible to be 75, particularly given the relatively low anti-vaxxer number within Canada, within Ontario. You know, if on top of this, people are also using rapid testing, et cetera, can we move from that 15% to 25% to 50% capacity and so-called non-essential retail? Well, it's non-essential potentially to everyone except for the owners and employees of those enterprises. And so it's important to keep reminding people how important this is, because we have lost tens of thousands of businesses in Ontario. We will lose thousands more before this is over, because people are up to their eyeballs in debt and beyond. And so we're going to continue to push on also where, because this is longer and you're pushing back, at least on paper, when I'm going to be reopening, I'd like to hear how you're going to be increasing the financial supports in the meantime. I'd like to see those small business grants get out to businesses faster, to look at potentially a third round of them. So there's a host of other issues that we're working on in the background, but at least we've got a base of conversation before we just, you know, we're waiting for a black box to talk to us.
That's right. Yeah. Well, thank you so much for your perspective, your glass half full perspective. I'm so like that as well. And there is a light at the end of this tunnel, and we will get through it as we have been together. It's very important. I think I really want to note, you know, every week the Ontario Chamber of Commerce and chambers and boards of trade across the province have been meeting weekly for the last year and a half, speaking on behalf of our members, on behalf of communities throughout the province, making sure that we're fighting for you, you know, getting those messages up to the people who need to hear them. And so Rocco, to you and to your organization, you have been absolutely incredible through all of this. The leadership has been just incredibly encouraging for our organization, for businesses across the province and country. And I really want to say thank you so much for your time today. And thank you for continuing to do what you've been doing for all of us. And we look forward to the continued collaboration.
Total pleasure. Leave on a bright note. Deaths from COVID in the UK are effectively zero now, right?
Yeah.
And that is largely on the back of AstraZeneca. These vaccines work, right? It is a real light. So let's accelerate. Let's do whatever we can. It's not to say there won't be cases, but if you don't have ICU, if you don't have hospitalization, and you don't have deaths, then you have defanged COVID. And that's what we're all trying to do. Stay positive, test negative, get vaccinated just as soon as you can. Thank you very much.
Thank you. And to the audience, if there are any last questions for any of our speakers today, please feel free to enter them into the chat while I wrap up. Again, to everyone, Christine, Rocco, Dr. McTavish, thank you so much for this important conversation, for shedding some light to our business community on what is out there and available to them, the steps they can take for themselves, for their employees, to keep everybody safe. And I will just hop over into some upcoming events to let everybody know. I don't see any last questions. So we did mention the rapid antigen screening initiative that is taking place across the province. Ontario, of course, first to roll this out through their chamber network, and the Ajax-Pickering Board of Trade, very proud to be a part of the initiative. I did mention we are expecting our delivery very soon, and so please stay tuned to how you can, to our communications onto how you can sign up for that program and get these tests going in your place of employment. And then I also want to mention that on June 2nd, we have a special session of mental health in the workplace coming up, another very important topic that many folks are struggling with through COVID-19. Signs, symptoms, and employment in a COVID world, presented by Bell Let's Talk. And this event is designed to assist businesses with understanding and implementing long-term mental health programs and initiatives in their workplaces. And will help you to build a strategy within your workplace. And so that is it for us today. Thank you all very much. There are some links in the chat. Sam, thank you. She's put the link to register for our mental health event coming up. Again, to our panel of speakers, thank you for your time this afternoon. Everyone is available to connect with if need be through myself or our Christine, Dr. McTavish at the region, and Rocco at the OCC. I wish you all a very, very great day. Enjoy the sunshine. Make sure you get outside, take a refreshing break, and we will see you all very soon. Stay well, stay safe. Bye for now.